You don't have to have it figured out when you apply for university, and you don't have to have it figured out when you get in. Many people who don't know what they want to do, and that's the great thing about finishing high school, is you start to make those decisions, and along the way, remember to just take it all in. Even if you make mistakes, even if you start something and it's not the right fit, be honest with yourself and know it's not feeling right, it's not jiving with what I want to do and with what my passions are. You're going to work jobs that you don't love, but it's all experience. And those are all things that will help you no matter what position you end up in, no matter what field you end up in, is just learning how to deal with people and being open to experiencing all of those things.
Hi, my name is Wade Phillips. I'm the clinic director, chiropractor, and a medical acupuncture provider at Summit Sports and Health. Summit Sports and Health is a multidisciplinary health clinic, so we offer a lot of different services. The idea is basically working as an integrated health clinic where we have multiple people that can serve a single person. We can better manage each individual that comes in. So we have chiropractic, physiotherapy, massage therapy are sort of the core services, and we built upon that as well with registered dietitian that's in office, as well as psychologists.
I'm Kimberly Gallus. I'm the registered dietitian at Summit, and I also work within the health authority in different parts of the province. A registered dietitian is actually the only regulated nutrition profession within the province. Registered dietitians can do a little bit of everything. Some people work with individuals, some people work with populations. On the individual end, registered dietitians are responsible for the assessment and the development of care plans and the implementation and the evaluation of those care plans.
Hi, my name is Catherine Krueger. I'm a provisionally registered psychologist, and I work at Summit Sports and Health. Provisional just means that I am in my 1,500 hours that are supervised by another psychologist, and when I complete that, I'll be applying for my oral exam. Once the oral exam is passed, then you become a fully registered psychologist.
Hi, my name is Mackenzie Marchant. I work at Summit Sports and Health as an attainment specialist. So what that means is I meet people where they're at in terms of their health and wellness, and I help them set goals, both short-term and long-term, and I help them overcome any barriers they might be facing in achieving those goals and learn strategies in order to achieve them for the long term.
I love a lot of things about my job. Probably first is I like working with people. It's a very social job, and you get to work with people, you have goals, you can kind of see those goals being met. So that's very rewarding to be able to work with people, work towards a goal, have success, and feel like you're helping somebody with their quality of life and whatever they're going through. I also get to work with a fantastic group of people, so the other practitioners at the clinic. It's always a privilege to be working with them. And the active side of the job, I mean, yeah, it's not sitting at a desk all day. That's honestly one of the best things about my job versus sitting at a desk and feeling probably at the end of the day that you need to go and get a run in or get some exercise in. It's like an all-day workout for me.
I see clients as young as 5 and older, so high school students, university students, adults. So what that looks like kind of across age ranges. If I have a 5-year-old in here, we're not going to sit and talk face-to-face sitting in the chair and the couch the whole time. We're going to be playing and engaged and practicing some different skills. It might look like doing some cognitive behavioral therapy work if someone's struggling with depression and anxiety and that kind of thought patterning. It's the dialogue back and forth, and the relationship is really a big centerpiece to what we do across the age ranges here.
I love being a registered dietitian because of the variation that it provides. I have friends who have gone into working in more community things and community initiatives that aren't necessarily dietitian specific, and I just love the variation, whether it's a person who wants to do better in a sport that they're at or a person who is fed through a tube. I love the science behind it and how we can nourish people in so many different ways, and health looks different on everybody.
There's a lot of different styles and there's a lot of different types of practice amongst the profession. So to expose yourself to different professionals and see how everybody works differently and see what sort of jives with you best. I think the more you can observe it and immerse yourself in it, the more you're going to understand what the career is all about and whether or not you're well suited to it.
When you see a client get that insight, that moment, that light bulb go off, that's a great moment to witness. And then the magic really happens when the client goes and applies that insight, or when they take the interventions you're working on and they start utilizing that and applying it in their day-to-day life, and they come back and you can see that they're feeling better, and they're reporting that they're feeling better, and you can see they're feeling more confident, their self-efficacy is growing. That's such a wonderful thing to witness. It just fills your cup and it makes all of it totally worth it.